Hi, my name is Dr. Roger Cohen. Here today, we are going to discuss drug caucus in California. The war on drugs in California hasn't been very productive or beneficial. California has traditionally been on the cutting edge of the marijuana reform policies. And although the war on drugs is not over in the United States, California today is probably one of the most liberal and progressive states towards people who consume and inject drugs. California, as a history, was one of the first states to prohibit marijuana in 1913, predating the Federal Marijuana Tax Act of 1937 by approximately 25 years. Fighting illicit narcotics has been a shared effort between the federal, state, and local agencies. This concept of federalism has been ongoing, with California accepting a larger percentage of the burden than other states. California adopted a mandatory minimum sentences for nonviolent drug crimes during the war on drugs, and it fueled mass incarceration, with many people ending up in jail. It was a terrible time with the 3 strikes issues in California. Cannabis, though, was officially introduced in California as hemp by the Spanish historically, and hemp culture prospered because of Spanish subsidies, which collapsed, though, with their end of their involvement in 1812. But they were brought to California at the Mission San Jose in 1795 with the incentive of Governor de Borica. The drug caucus in California has been an ever-ending change. California's drug wars have shown how state and local governments played relevant roles in the 20th and 21st century processes of penalizing drug use, creating a drug policy, and enduring enforcement cultures through public policies and procedures. The drug control policy at every level in the United States during the 20th century has prohibited the recreational use of conscious altering drugs, and consequently criminalized and punished users and sellers for any type of drug that altered the consciousness of a person. The number of individuals convicted of federal drug offenses more than doubled, from 5,244 in 1980 to 12,285 people in 1986. These statistics accounted for 51% of the number of persons convicted of all federal offenses, which increased from 29,952 in 1980 to 43,000 by 1986. The Comprehensive Crime Control Act of 1984 and the Anti-Drug Abuse Acts of 86 and 88 were passed during this period. Although people who inject drugs, though, comprise less than 1% of the United States population, they are thought to experience 56% of new hepatitis C virus infections, and 11% of new HIV infections. In various emergency room settings, skin and soft tissue infections are the leading cause of hospitalization of people who are injecting drugs today. During the growth of the Cold War years, there was a growing paranoia, and the greater Los Angeles area flourished in the years after World War II, and it was full of drugs that were considered mysterious, exotic, and calculated a foreign threat to the United States. While Californians wanted to solve this increasingly dangerous problem with cross-border controls and coercive drug diplomacy in Mexico, federal officials were finding an argument against communist Asia, and it became part of the drug policies going against the Asian cartels. The San Diego and Mexico border controls were increased, and violence along the U.S. border with Mexico was increasing, especially near the San Diego, Tijuana areas, and has been a focus of political controversy for many years, since there are many concerning issues involved in the situation. Because there's the flow of billions of dollars of illicit drug trafficking through the border, the illegal movement into Mexico of assault weapons purchased in the United States by drug cartels and other border states, and as well as human smuggling rings and human trafficking mafias that are kidnapping people across the border between Mexico and the United States. Even if it is debatable that consuming marijuana induces violent behavior, American public opinion associated its consumption with lower social classes of Mexico, since they were thought to be their main customers of marijuana use during the growth of the war on drugs. Apart from the historical association of the Mexican drug cartels with poverty and violence, some researchers have argued that they work and function as terrorist organizations. Amid the growing paranoia of this time, Californians wanted to solve this problem, though. In 1996, California became the first state to officially allow medicinal cannabis use when voters passed the Compassionate Use Act of '96. Today, cannabis is legal in California for medicinal and adult recreational use under conditions. The cannabis industry is strictly regulated in California to ensure the drugs are kept away from children or people who aren't supposed to be in contact with it. Today, though, arrests are one of the public policies associated with marijuana possession and distribution. It is crucial to have data on these arrests going forward, though. These dispositions to assess the personal consequences and estimate the current losses of marijuana enforcement go into how police are handling their drug and seizure laws. Please see one of my other chapters on civil asset forfeiture problems within the cities and states in California to assess how police policy is being done in order to fund their departments through illegal search and seizure of drug policies in California. Since state law indicates that those possessing less than 1 ounce are generally supposed to be cited without booking, we can safely infer that most of the subjects arrested for simple possession are not incarcerated anymore in California, and that does help with prison overcrowding. So we do have some recommendations that I want to make. So we need to start having high quality scientific evidence that's supervised, that's done correctly, about drug consumption and how it facilitates the achievement of California's public health, and also gives objectives with a lack of adverse impacts. It's something that will support how California could serve and give services and support Californians and improve the state of Californians with a policy that does not penalize and incriminate Californians for the possession of not just cannabis, but other drugs. We're not here to imprison people and to incarcerate people just because of personal choices. It's not a moral decision that the state needs to enforce upon you, and it's not the state's morality. You have a right to choose your own morality, and public policy needs to reflect that, supporting you and not criminalizing you and filling up the prisons with people who have alternate or different moral positions than you. New legislation must be clear and understandable, since the opposite may open the door for abuses within the Californian system. We need people to be able to have access, who need access to different types of drug or marijuana uses for treatment of cancer, for treatment of other diseases, and allow the free research into the free market to allow research to occur so that people can look at the positive benefits as well as the negative benefits. Drugs trends will evolve, and drug prohibitions are having problems with the increase that we see of laced fentanyl within drug supplies, creating large amount of overdoses and deaths of people because the sources that people are getting are tainted. We need to be able to decrease death rates of drug use by decriminalization so that the purity of use and consumption is not tainted by cartels from Mexico or bad production lines and strains. If people are going to be using drugs that are considered illicit or illegal and it's tainted with fentanyl and they die, the reason that they died firmly rests in the prohibition of the use of that drug. It wasn't able to be tested. It wasn't able to be safe, and people took a risk and died needed in the state of California because of regulations by the state. I leave you today with questions to think about. Decriminalization in California under state law will allow for an impact on public opinion. People may or may not be for it, but we have to be thinking about what policies can be implemented to change the stigma, what policies can be changed to save lives, and what policies could bring down cartel control over people. And until we come to a public policy discussion to give people individual choice and free choice, California will continue to incarcerate people unnaturally more than they should. I'll see you again on one of our next discussions.